Do you have questions about Medicare Part D prescription drugs? You're in the right class. This is Janine, your Get Set Up Guide and Medicare expert, and today we're going to talk everything prescription drug coverage. But before we get into that, let's talk about Original Medicare. Original Medicare is administered through the Centers for Medicare and Medicaid Services, CMS, and it consists of Part A, which is your hospital coverage, and Part B, which is your medical coverage. Now, when you get to Part C and Part D, those are administered through private insurance companies. Part C is going to be a Medicare Advantage plan, which puts your Part A, your Part B, and sometimes your Part D all together into one plan. What is Part D? Part D is going to be your prescription drugs, and that is what we're going to be talking about today. Now, prescription drugs coverage became important because, as you know, prescription drugs can be very expensive, and the government wanted to make sure that you had some affordable options. So Part D was born out of that. And you want to make sure that you get your Part D as early as possible, because if you don't have what's called creditable coverage, which creditable coverage is coverage through an employer just as good as what Original Medicare covers. If you don't have that, when you turn 65, then you become eligible for late enrollment, which we'll talk about a little bit more later. But before we get into that, let's talk about prescription drugs and how they work. So when you're looking at prescription drugs as of 2025, there is 3 stages. There's the deductible, there's the co-insurance, co-payment, and then there's the maximum out-of-pocket. The deductible, and we're talking about basic plans here, the deductible is going to be what you are responsible for before the insurance company starts to pay. That is going to be your deductible phase. After that, you go into what's called a co-insurance co-payment. That's where you pay some, the insurance company pays some. It could be a co-payment, $10, $15, or it could be a co-insurance, which is going to be a percentage, 10%, 15% of the cost of the drug. And then finally, it's the maximum out-of-pocket. Once you reach $2,000 in 2025, then the insurance company is going to cover you at 100%. So, deductible, co-insurance, maximum out-of-pocket. Once you understand those 3, you have to understand the formulary. So let's talk about, what is a formulary? A formulary is what the insurance company determines how they're going to cover your prescription drugs. So on a formulary, your prescriptions are going to be on different tiers. The lower the tier, usually the lower the cost. Tier 1 is going to be those drugs that the company prefers. Now, on a formulary, one thing you need to know is the insurance company has to cover every type of drug, but not every brand of drug. So they are going to have certain brands that they prefer more than other brands. So that's where that Tier 1 preferred generic comes in. It's what they prefer. Tier 2 is going to be non-preferred generics and some brand names. It's going to cost a little bit more than Tier 1, but it's not going to be very expensive. When you get to Tier 3, you're looking at those preferred brands. Those are the ones that the insurance company, the brand names that the insurance company prefers. Although there may be some generics on there, but preferred brand, going to be a little bit more expensive than Tier 2. Tier 4 is when you're looking at those non-preferred drugs. So it could be a brand, it could be a generic drug, but it's not preferred by the insurance company. Tier 5 is going to be your most expensive tier. Those are those specialty drugs. And so specialty drugs could be combination drugs. So those really expensive drugs are going to fall under Tier 5. Now, some insurance companies also have what's called a Tier 6. Tier 6 are going to be those maintenance drugs, those common maintenance drugs that a lot of people are taking. Now, another thing you need to understand about a formulary are cost containment measures. Some of those include quantity limits, which limits the amount that you can get per month. It could be a prior authorization, where you have to have prior authorization from the insurance company before the pharmacy is able to fill the prescription. Or it could be something like a step therapy where they want you to try a different drug that they do prefer as opposed to the one that they don't prefer. Now, another thing that you need to consider when you're looking at the formulary is preferred pharmacies. There are certain pharmacies in a network that the insurance company may prefer over standard pharmacies. So you want to go to one of those preferred pharmacies if you can. Now, how do you get prescription drug coverage? prescription drug coverage comes through an insurance company. It can either come as a standalone prescription drug plan, or it can come as a part of a Medicare Advantage plan. If you do a standalone plan, that's if you choose to have your original Medicare, or if you choose to do a supplement, you're going to need a standalone prescription drug plan. The Medicare Advantage, the prescription drug plan that comes with the plan is the prescription drug plan. You don't really have any choices when you're looking at a Medicare Advantage plan. You enroll in your Part D coverage when you turn 65, unless you have creditable coverage through an employer. If you don't enroll during your initial coverage enrollment period and you don't have creditable coverage, you will have a late enrollment penalty. There will be another class where we'll discuss late enrollment penalties, so we're not going to go into those too much during this class. You also want to make sure that you are signing up when it's necessary, because you never know when you may need the prescriptions. And prescriptions, again, can be very expensive. And so you want to make sure that you have that safety net so that when you do need the prescription coverage, you have the prescription drug coverage. Now, what are some common questions that people ask? Some of the common questions are, what if my drugs aren't covered by the formulary? Well, you do have some options there. You can choose another plan, or you can ask for a formulary exception. That means that you're asking the insurance company to make an exception for you and to cover this drug, although it is not on the formulary. And you can also file an appeal. An appeal is going to say, I know it's not on the formulary, but I want you to cover it. So you can file that appeal also through the insurance company and to also Medicare. Also, another question people may have is, can I change my plans if I need to? The answer is yes. But you can only change your plan during the annual enrollment period, which is October the 15th through December the 7th. And your new plan will go into effect as of January 1. So you want to make sure that you're checking your plan during the annual enrollment period. And then finally, how do I choose the right plan for me? Well, you're going to want to make sure you're looking at all of your prescriptions. You're going to need to know the prescription name. You're going to need to know the dosage. You're going to need to know how often you take it. All of those things are going to play into whether or not this plan is going to work for you. And so if you're another way that you can get help is you can contact Medicare.gov, 1-800-MEDICARE, and they can go through the process with you. You can contact your state health insurance program to help you, or you can talk to a trusted agent or advisor, and they will also help you to determine what plan may work best for you. Now, just to recap really quickly, some of the things that you want to make sure that you understand is sign up for Medicare Part D when you become eligible for it. If you don't have creditable coverage, it is very important that you are looking at the formulary for each company to determine whether it's the best plan for you, and also the pharmacy network so that you're getting the best deal. This has been my joy to talk to you about prescription drug coverage for Medicare. I look forward to talking to you again in our next class. Thanks. Have a great day. Bye.